This is Pentadeca, the equivalent of BPC 157. This is TB 500. Both of these things are in the lay press or anecdote. These are used for injury, muscle injury, especially with my bros in the gym. How I use it and how I think it can be effective for reversing inflammation quickly. I just did a turkey trot. This is my son's number. That's my number. Just finished a turkey trot, which is a 5K. 5K, 3.1 miles, not a big deal. If you haven't trained, it's a big deal, especially for your soleus or gastroc. Those are the two muscles in the calf. And I was able to go. I don't remember what my time was. I'll look it up later and post it. Not my best, but hey, this is the countdown to the Shamrock Shuffle, which is in March 23rd, I believe. I always have to put these anchor events into my life to make me get past the winter of Chicago quicker. Otherwise, it gets to be like, oh, this is so monotonous. And if you kind of zoom out and you figure, what's the timeline going to be and how can I get through this quick? Or more importantly, how can I stay motivated when all else is like cold and dark and short days? If this is the first time you're finding me, please consider subscribing if this kind of video information helps you, or pass this on to other people that are old, trying to recover and trying to reverse disease quickly. I'm 62, and if I get to, when I get to 72, I don't think I'll have the energy anymore. I'm hoping I will if I follow the blue zone kind of lifestyle. But you know, other things can get in the way, and hopefully nothing happens. But if I play my cards right, I've already started prepping from like 20 to 30 years ago, which is why the payoff is now if I just maintain real easy. You know, sometimes things get in the way, like pandemics, influenza. Yeah, I just got my influenza shot. I do work for a corporation and I have to honor the rules of the corporation. Otherwise, I am an integrated medicine physician in Illinois. I run a virtual practice, and I'll put a link down below. But I see people from all over the U.S. and just a handful of people outside the U.S. Since COVID kind of calmed down, my patients that were initially with me outside the U.S., and hopefully they're healthier. For all of you, thank you for joining up with me and still following and subscribing to me. Here's the idea with peptides. Actually, your body makes peptides. It's a chain of amino acids. So most people know, oh, amino acids, that must mean protein. And it does mean protein in a big sense. So if you have an amino acid which is stuck to another amino acid, which is stuck to another amino acid, and there's a long chain, you can have two amino acids together, that can be a peptide, and up to about 200. I think the definition for what is a peptide and then what is a protein, there's a little bit of a gray area, but bottom line is that you have a string of amino acids that are put together synthetically, usually, to mimic your own peptides. And those of you who are diabetics or you have relatives who are diabetics, you'll know that the most known peptide is insulin. And insulin has been around for a long time, and it is a peptide. You can formulate it, you can make it, and if you don't make insulin, like type 1 diabetics, T1D, you can use insulin and survive. Now, those of you who are T2D or type 2 diabetics who are really out of control, sometimes you'll need a little bit of insulin, so you'll be able to inject that peptide in your belly once or twice a day. So the most infamous peptide now is Wegovy or Ozempic. Those are GLP-1 agonists. And they are peptides. Before they became popular, actually they've been out for a while, but nobody liked it because you had to inject. And the mindset of patients was, I don't want to inject insulin. And I think by default, patients, when you give them a pill, they're okay with it, kind of. But when you give them a shot, it's like, I'm not that serious, am I? I don't want to shoot myself up with anything. That was the thinking before. That's why it wasn't that popular, unless you were really bad with your diabetes, uncontrolled, not doing anything with exercise, can't exercise, don't watch your nutrients, don't know how to watch nutrients. Insulin and those GLP-1s were useful. Now, the pharmaceutical industry's made it into a snappy little pen where you don't see the needle, you just click something and you put it against your thigh or your shoulder and you push it. And you hear click and it's a sudden tiny jab, but it's nothing like a vaccine. The idea with peptides is to shortcut your body's check and balance system and then have you apply your exercise and nutrition and proper sleeping habit with more vigor, with more response. So those of you who are in your 50s and 60s, when you see me or a lifestyle change, an algorithm, a template, a plan, you know it's really tough. You know, if you exercise and I say, okay, this is the first time you're exercising, we'll start you off in this next month and we'll ramp you up over the next 3 months. It's like 4 months. Who wants to wait that long? And it's true. I think people get demotivated when the prize is too far away or unfathomable. That's why you have to have little anchor events or little wins to get your dopamine response. Every time you have a win, dopamine flies up high and you want to do it again. You want to keep on pursuing that lifestyle change. If you don't feel anything, if you don't see any scale change, if you don't see any clothing loosening or waist size loosening, then it's very frustrating. If you're mired down with just a lot of disease and symptoms, have no fear, but you have to have patience. And I think if you get that lifestyle change going, these things can speed up your healing time. I think I did a video calling it Wolverine Peptide because you do heal up faster. Now, there is a downside to both of these. They both work in a different way. This comes from the digestive tract. This comes from a derivative of, there's a gland here called the thymus gland. Usually it's obliterated, goes away when you're in your teens. But when you're a baby, there's a big gland that's right here on the chest x-ray. It's supposed to be there to initially develop white blood cells, act as an immune support, figure out what you're going to be immune to later on. It's really cool. There is a peptide specifically to take the place of your thymus gland if you're fighting a cancer or an autoimmune issue, and that's called thymosin beta 4, TB4, and it's a big peptide, kind of like this is a big peptide, but TB500 is a small section of that big peptide. Before we get all confused with this, the big peptide is thymosin beta 4. And it's supposed to mimic or stimulate your own cells in your body to react like you have a brand new thymus gland. And when you have a thymus gland, you can fight infection more, you can heal up faster, you can protect your brain, you can protect your heart cells, even get more hair. What I'm trying to do here, which is speed up my healing, I'd like to shortcut it and just do TB500 would be great. Both of these together cannot be mixed in the same syringe. If you mix it in the same syringe, there's 2 different pHs and it might come out of solution, so don't do that. You have to have 2 syringes to stick yourself with these super tiny needles. These are 30 gauge. They're kind of like diabetic insulin needles. Don't think that you're going to be able to aspirate this fluid out of this vial. That's one of the vials for a Pentadeca. I use bigger needles to put in here, aspirate out the fluid, and then I switch needles to the tiny guy and I inject it wherever I want to inject it. The idea is that this is just an alternative, and if you are suffering from delayed healing or you're fibromyalgia sufferer, once you get injured, you are injured for weeks. That's just very defeating. So I want you to know how to throttle your investment in exercise, and sometimes you need a coach to do that and watch over you and say, okay, that's enough for today, or that's enough for this week. Recuperate, recover, and I'll see you in a week. Some people have the mindset of an athlete. Oh, I can do that. I'm going to lift 5,000 pounds. They go to the gym for the first time in years, and then they get hurt, and then they're in bed, or they're taking narcotic and muscle relaxers because they're in too much pain. That's not how lifestyle is supposed to be changed. It's supposed to be incremental change. And again, if you are not seeing changes that fast, you can't build up your resistance, then we can speed it up with proper tempo. Sometimes when you've been away for a while and you reintroduce it, you'll notice changes nicely. Either strength increase, tolerance to cardiovascular fitness, the fast heart rate. It's called newbie gains. Newbie gains make it motivating because you can see that you're advancing fast. That might last for 3, maybe 6 months, but then your age shows and your body accommodates and adapts to what you threw at it. And that's when we have to throw more into your exercise routine or your nutrition practice or your fasting practice, and we challenge the body to adapt again. And sometimes when you take forever to adapt, well, guess what? I can speed that up. You always have to do this with guidance. And you also have to be careful that when you get this stuff, that it comes from a compounding pharmacy that's 503B and 503A certified. That just has something to do with certification by the state. If you get it online from a sorely person that works at your gym, the black market stuff, you're taking a chance. You can have LPS in these things, and that's just dangerous. Those are endotoxins, lipopolysaccharides that come from bacteria, but please be careful about where you get this. If you're one of my patients, you can get it from me. I'm about to put price points for my favorite peptides on my website. I'm experimenting with it myself first. I usually would do BPC 157, also known as Pentadeca now. So this is daily. You can also break it up into about 500 micrograms spread over twice a day, but I think once a day would be fine. And you don't necessarily have to put it in an area of pain. So if you have shoulder problems, the suggestion is you put it around the shoulder and the subcutaneous tissue around the shoulder. I now have calf pain, soleus muscle or gastroc, I'm not sure which one, but after doing the 5K, I haven't done any running for 2 weeks because I pulled a muscle on my right with my last run I did in Utah for my nephew Ryan. And I could have sworn I tore my muscle in half. It was just, I could feel a divot in my muscle, and I thought I better get a MRI, but I didn't have the time to get an MRI. However, you don't come back from muscle pulls that quick, and I tore a muscle in half. Okay, maybe I just strained a muscle. 2 weeks to come back is unusual. I mean, I had black and blue and blood down in my ankle that was draining from the tear. I just finished a 5K in like 13-degree temperature, and I'll hopefully be, knock on wood, fine with maybe doing another 5K. I'll do it again. I try to challenge my body, whether it's climbing at 14,000 feet or hiking distance or lifting heavy or hitting a max lift. I try to do that to make my body adapt. And when your body adapts, it builds muscle. When it builds muscle, you have strong bone. When you have strong bone, your metabolism is under control. Then you don't have to become a pre-diabetic, and you can melt your cholesterol away. I can also exercise my heart to the point where hopefully I don't have a heart attack. The idea is to shorten the healing time. And I'm going to be injecting TB500 into, let me just see which calf hurts more. My right, that's the one I tore 2 weeks ago when I did the run for Ryan. TB500 I use twice a week. Pentadeca I use every day. I've been using Pentadeca. I usually put it in my belly because I have more fat there. And I'm going to be apprehensive with injecting this around the area of my injury, which is my calf muscle, because I don't have that much fat. So I've already freaked myself out by thinking, okay, this is going to hurt. And when you think it's going to hurt, you're probably going to hurt. You don't just use it without guidance from a doctor. And you can use other things too that will all work to accelerate your healing. If you're young, honestly, you probably don't need too much because you'll heal up regardless, and you can eat all the crap in the world and still digest that somehow. If I just look at a picture of a piece of chocolate, I'll start gaining weight, which is really frustrating, but it's fine. All right, so this is my left calf. This is about where this is about where it hurts. What a trigger point. I'm going to prep this in my left, which doesn't hurt as much. I will use Pentadeca, which is over here. Again, this is a subcutaneous shot. I take all the air out of here as best as I can. 30 gauge syringe right over here where I wiped it down. I'll have to tent up my skin because I don't have much fat, and that's not bad. I mean, I don't feel anything. So just have to penetrate through, aspirate to make sure I'm not in a blood vessel, and inject. Get a little bit of skin raise. Theory with animal testing and bro science is the medication goes where it has to go. So even if I put it in my belly, the peptide should circulate around and go where it's needed. If you're directly trying to take care of inflammation, you use it close to the site of inflammation. So let's change over to my other leg. So this is my right leg, which was the one that was torn. I don't think you can see it anymore. There's old resolving black and blue right here in the gutter because it was torn here and dripped down to here. I'll see if I can find the picture where it was black and blue. And when I felt, I could feel a divot. I think I tore. Regardless, I'm going to put TB500 over here. So I've already loaded the syringe. And as far as one versus the other, they'll get to where they have to go. But just to experiment. This is a 30 gauge, entering skin, little bit of a sting. Just make sure I'm not in the blood vessel. Supposed to be in sub-Q, and we're good. So inject. Ooh, you can see a little wheel here. So one word of caution when you do these injections, you want to get it into that tissue underneath the skin, which is right above the muscle layer. But if you can, that would be the perfect scenario. If you can't, locally. And if you're wimpy, then you can always go, because most people have a little bit of adiposity here, you can go here just to inject and you will hardly feel it. So the bottom line is that when you put any of these peptides in, whether it's by mouth, which Pentadeca is available by mouth for gut-related issues, or by injection like I just did, or by nasal spray, which I will be doing a video on soon, it gets into the system and it, believe it or not, goes where the system hurts the most, especially in the case of musculoskeletal pain. So just like stem cells, if you've ever done stem cells or heard about stem cells, if people are trying to, say, rebuild cartilage here or rebuild cartilage in their knee, they'll get a stem cell injection. It's very popular with orthopedics. And you don't have to put the stem cell right into the joint, but the data shows that if you put the stem cell IV, it concentrates when it was a small study, it was radio labeled stem cells, but it concentrates into the area of inflammation. That's where the body needs it most. So same thing happens with the peptides. So hopefully this gives you a rough idea about how you can take advantage if you're old like me, or if you're trying to get young again and you're just being hindered by pain or inflammation, or you can't get over that hump of discomfort or delayed onset muscle soreness. This might help you get past that really quick so you can go on and enjoy the fruits of your exercise. So please think about subscribing. I'll be doing more on peptides, and I'll do more on lifestyle change, and that's what the concept of integrative medicine is. And hopefully this helps you. If it doesn't, or you know somebody that would benefit from the information, please send this to them or send the link. Otherwise, I'll see you in the next video. Thanks for watching.